There is concern on whether South Africa will meet its vaccination targets. Roughly only 1% of the population has been vaccinated so far. Today, the minister in the Presidency, Khumbudzo Nthsavheni, said the slow rate of vaccinations is not the government's fault. Nthsavheni says countries like the United States, Canada, and lots of other European countries are hoarding vaccines and there is no equitable access. Well, some believe that the focus on the pandemic, rightfully so, has compromised other patients in the health system. Tonight on the Watchdog, we look at the country's slow rate of vaccination after President Cyril Ramaphosa put the country on an adjusted level for lockdown, while on the other hand, we're starting to see silent victims of the pandemic within the health system. The Watchdog starts now. Well, our first guest joins us from Manchester in the United Kingdom. He's a South African doctor who has seen it all, having watched what is happening in his country from afar, but also someone who's very much connected to people here in South Africa via social media. Tonight, we thought we would ask him to just share with us some of his thoughts and observation from his vantage points. Dr. Sangla Khosani joins us now. Dr. Khosani, good evening. Thanks very much for your time this evening.
Good evening, Vuyo, and thank you for having me, and good evening to the viewers.
Well, I mean, your friends, relatives, you would have seen them talking over the past 24 hours since President Cyril Ramaphosa took us to level 4. What immediately, came to your mind as you saw people interacting with the content, the speech that he delivered last night?
Okay, we will leave the lighting out of it and the somber mood and address the issue that the meeting, the address by the president comes in June 2021, where the country hasn't moved much since April last year after the initial lockdown. And the focus, unfortunately, all the time will be on alcohol and the other things that are peripheral to the main issue. This pandemic has shown us the level of infrastructure, health, resources that different countries have got. And in our case, as South Africa, we have been shown up that we've got none. We started our vaccination rollout in May, and it is going in a bit of a slow pace. I can hear the vaccine appetite. I saw the story that was published after the minister in the presidency said that, but that then absolves the government of their responsibility because they're pointing elsewhere. In terms of comparisons, if you look at what South Africa is, or what we thought South Africa was, a superpower in Africa, our response to this pandemic has been poor, to say the least. And we have been helped by the private sector. And in the setup of the Solidarity Fund, before SA, and all the things that they've done, mind you, it's not supposed to be that way, but it is what it is. If the private sector hadn't stepped up, there wouldn't be anything happening at the moment.
What is it that he needs?
But, no, I mean, what you've just said raises a number of things, and I want us to go through them, through a couple of them. Starting with why we started late, because I remember months ago, there was actually a plan. People said there was a plan in place. But this plan, as critics of the plan pointed out at the time, didn't really we were late to start off the blocks. When we were still putting a plan on the table, other people had already spoken, to companies that could provide the vaccine. So it's the late start, and I want to check whether you agree with the critics on that one, that it was a bit late.
It was very late. We've got that spot on. Now, I want to take you back to Prof. Karim's presentation when this all started, because I want to cover this in terms of the vaccine rollout and the response to COVID, because these two go together. If you remember that initial presentation that was done, Prof. Karim put some slides up, and he explained that's when we first found out on the government presentation about the R number, which was already in discussion over here. And then he explained that we're going to start to open as the R number does this and does that. But after that presentation, it was just a level of 5, 3, 1, 1, 3, 5, but we never did the staggered opening that Prof. Karim spoke about. That was the initial thing. And then in all other governments, when you do the lockdown, you then do a relief plan to cover the citizens during the lockdown. Here in the UK, it's called the Fellow Scheme, where the COVID-19 injection program, where the employers are paying the employees up to £2,500, which they then claim back from the fund. You had the same situation with Joe Biden in America, and you have the same situation with Jacinda Ardern in New Zealand. And then we had the 350 Rand, which the Congress decided to expropriate as well. So it becomes then difficult for the South African to say, I am going to abide by the lockdown regulations because people have to work. If the government isn't supporting the people in doing what the government says they should do, then it becomes a problem. Yesterday, the president spoke, as you said, but what did he say about the relief fund?
Nothing. See, now, we'll get to the relief fund in a second, but I just want us to continue or to ask you a point about that plan. Among the critics of the plan are people who say that even after we then had the plan, South Africa took a while to commit to actually sourcing the vaccine, more or less kind of adopting a wait-and-see attitude before they could make actual, real commitments. And by the time we were able to do that, the bus had left the station, so to speak.
Okay. Now, as I said, the vaccination rollout in South Africa started in mid-May. And I agree with you, that was very late. In the UK, it started in December. And even though Boris Johnson started fumbling, shaking hands with people with COVID and got COVID himself, and it ended up in ICU. But he's finishing quite strong because he procured 3 vaccines. He's also got an understanding to procure Johnson & Johnson as well, which makes it 4. And at the moment, they're talking about the booster dose. So started in December with a target of finishing the whole population by July. So as of now, there's about 44 million with first doses and over 30 million with second doses. In South Africa, yesterday, I think we were told of 1%, I think, of the population being vaccinated. And it's a very slow uptake, especially at the 60 plus. Now we're opening up to the 50 and the 59, but the uptake has been quite slow because you have to understand there was also the situation of which vaccine to procure. And a decision was made that we will go with one as South Africa because, as it was explained then, the variant. But if you recall, there were certain professors who were in disagreement, saying that the AstraZeneca that had already been procured should also be used. Because what we're looking at with vaccines for COVID is preventing severe disease, hospitalization, and death. And Prof. Mahdi was very vocal and is still saying it even now.
It continues to say that.
He was saying it then that it should be used, and he's still saying it now.
With the benefit of hindsight, and on the back of what you have you have just said. Is it what can be done from your? I mean, you had the Boris example of what he did to really gather, the nation behind him. Whereas right now in South Africa, increasingly you're seeing people saying President Ramaphosa ought to have done better. From where you sit, having observed other jurisdictions, other nations, and where they may have slipped, how they were able to catch up. What is it that a President Ramaphosa can still do right now to rally the nation behind him? Because what is beginning to happen now, where people are becoming disillusioned, they don't like what they are seeing. That's the last thing you would want as a head of state in the middle of a pandemic that truly and honestly, by and large, you really have no control over. What can he still do that is within his means, that which probably other world leaders did or tried to do at least?
Now, you use the word within his means, which becomes a problem because, as you know, there was the Auditor General last week giving you the number of billions in the municipality. There's the SIU that is dealing with its own amount of all the money that unfortunately did not go where it was supposed to go. And it was handled by people in government and it went elsewhere, starting with procurement of PPE and everything else related to COVID. But now if you tabulate that money and get to the figure of the billions that it is, and then you take that money, you go and procure the vaccines that are available. Now, you are late as always because Dr. Tedros said it a few days ago that supply is a problem now. Mm-hmm. Supply is a problem now because you can't be buying now when you should have bought in December. And I hear the people that are complaining about hoarding, vaccine apartheid and all of that. But if you do not have the money now or didn't have the money to procure and the money went to places that it wasn't supposed to go to, you are then going to have this problem. And then there was also the Minister of Health who told us clearly that there was irregular, fruitless expenditure in the Department of Health during a pandemic. Mm. What does the president do?
Asking because, and this is a point of bringing you on this evening. You have the minister then saying it's not our fault, it's things that are beyond our control. You have the problems you have just spoken to of where money has disappeared, and that money is not going to come back any time soon. You have a lot of blaming one another for who did what or who didn't do what the role of the regulator should have been. You would know about the march that the EFF organized last week, saying the regulator could have done more. We could be procuring vaccines from other places like Russia, for example. Now, in the middle of this whole thing, right, there's a reality. And that reality is that we are not going to be able to vaccinate too many South Africans, not in the very near future, number one. Number two, which is a story we're getting to in a short while, you have other categories of people who have not been infected by the coronavirus, but who have other illnesses that require just as much attention. But as one report we're going to get into in a short while shows, there is those people are feeling neglected. They are not getting the health services that they have been getting all along. So we are in this, fairness, as it were, where all of us are battling to survive and we're blaming one another correctly in many, if not most cases. But how do we get out as an outsider looking in with obviously, an interest in what is happening in your own country? What would you say? What do we do from our in our respective little corners?
Now, I like that question. you want solutions. And unfortunately, for us to get there, we need to know what resources we've got. The blame culture, blame game isn't going to help us. The report came out when there was a briefing from the acting health minister about which vaccines are effective against Delta, and it was Pfizer and AstraZeneca. We gave away our AstraZeneca because we procured 30 million doses from elsewhere and didn't put the orders through different companies so that if anything goes wrong, we were able to cover and be able to still vaccinate. Because you've got to think about this, we don't know what is going on. So if you've got different vaccines with proven efficacy, you are then able to adapt with the times. So how are we then going to deal with Delta and South Africa when we don't have AstraZeneca at the moment? Only Pfizer. And I think there was a question that was raised to Dr. Linda Barker, and her response was, we don't have figures at the moment for J&J in response to Delta. So what resources do we have now to adapt and say to COVAX, with what we've got with you, give us this. Because all we need to do is just to keep it moving. This is the situation we are in at the moment. We need AstraZeneca. We need Pfizer. How do we procure them?
You know, over a week ago, we had Dr. Crisp, who's the Deputy Director General in the National Health Department, and is specifically dealing with vaccination. And you could sense that he was feeling that, you know, people who are outside of that system that has to look at everything that we've got and what to do with the resources at our disposal, when and given factors they say are beyond their control, which is, you know, the issue of supply. We're not really seeing things from their point of view. And as a result, we are simply not empathic. And all we really seem to be harping on is criticizing those who are actually doing their best to, you know, try and address this situation. Would you agree with that sentiment?
Okay. Let's try that this way. You are watching the Euros at the moment, right? You saw at Pushkar Stadium how full it was. And you can see in the other stadia as well, most of Europe is reopening. The economy, I think from last week, the economy of the UK grew. And they will spend 6 to 7 billion this year on the fellow scheme, 16 billion last year. Vaccination started in December with the target of finishing in June. So if you do things the right way, you get the desired result. So we might be outside of what they are thinking, but there's one thing that is evident at the moment is that we've got the Delta variant, and the figures done here are showing that 2 doses of Pfizer and 2 doses of AstraZeneca work. And we did have AstraZeneca ordered.
In the UK, do you see, you probably wouldn't given what they have been able to do, but what are the other conversations that citizens have been having during the course of this pandemic?
Now, we are here in the UK. There hasn't been much of the conspiracy theories and the anti-vax because the figures are talking for themselves. And when you've got the support of the government, when they say stay at home, work from home, and you get 80% of your salary, you are not going to get the problems of resistance. Fine, there are pockets here and there, but the nightclubs are closed, the bars were closed, everything that needed to be closed were closed, but that was coupled with financial support.
Which then brings us to the issue, the issue, one of the key areas of your concern, that the fact that we now no longer, or the government is no longer able to support those people who are in need, it just heightens the tensions, and obviously for the very same reason that these people were given some kind of relief before, when you no longer have it, then you're going to get a lot of agitation, restlessness, and desperation.
Yes, you will, especially when if we look at the other numbers. For example, in the last 3 days, the tests done in South Africa were averaging between 40 and 70,000. I think today it was 40. And the positivity rate is high, yielding about 14, 16, 17,000 cases, which are similar to the cases that the UK is producing. But the tests in the UK is over 1 million a day, but giving you the same number. And the number of deaths have been in the single digits for the last 3 weeks, only starting in the last week to get to double digits. And the number of people that are being hospitalized are non-vaccinated people. So we start the conversation from the fact that the vaccination program is working. Now, we then move backwards to South Africa, where I open up by saying, we as South Africa are still where we were in April last year. We've not moved. And unfortunately, it goes back. Someone's got to take responsibility. But I hear what you're saying, that everything is vaccine apartheid. No one wants to take responsibility. We're all outside. But at the end of the day, someone's in charge.
Now, the private sector has said, they're prepared to come on board. And throughout this period, they have expressed a great deal of frustration that they are not being listened to. The government seems to be set in its ways, and we do the same thing over and over again, hoping for a different result. Just from your experience, or from reading literature, in other countries, and the UK included, where people have seen, whether it's the hesitancy or really tardiness, on the part of the government, have there been instances where the private sector has come in and done something different to what perhaps the South African private sector has been able to do up until now? In other words, have they come up with ways to nudge the government, or if not nudge, force them actually to think differently or do things differently, leveraging on the power that they have and that they are always happy to use when they have to make money?
Now, the health system here is governed by Public Health England, which manage the NHS. So everything is government. I like how you've approached that, because I've just spoken about testing now. Everyone here can get a test whenever they want, and it's all government. The only people that are getting private testing is people who are flying, so they need to get the travel PCR. But for coronavirus testing, in terms of being ill with it or sick with it, symptomatic or not, it's a free test done by the government, which is why I think a few months ago we did change, and the WHO was saying test, 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 test and test again. So if you don't do that and you are not capacitated, you are going to be limping through the pandemic. Now, we go back to the 800 Rand in private that is happening in South Africa, and the fact that there you are now being charged for the rapid test, which the UK government has rolled out to the health practitioners at first, so that we can do them twice a week for free. And now every household has got a box, and they're encouraged to do it twice a week. But it is for asymptomatic people. No one is making money from the private testing, from the rapid testing, sorry. It is designed for asymptomatic people. Now, the problem you have when you are paying for it down there is that you are then going to do a lateral flow test, the rapid test. It gives you a negative result, and you go on with your life, whether you are symptomatic. But now, ideally, when you are symptomatic, you shouldn't be doing that. Now, the private sector is making money from these. Here, it is the other way around. There is no influence from the private sector in helping the government. The government is doing what it needs to do for its own citizens, using its own fiscus.
Going forward, Doc, how do we, as South Africans, move together and say, you know what, we are aware of the problems, which we will resolve. But fact of the matter now is that we have to deal with what is confronting us, with everything that broke, everything that went awfully wrong, the mistakes that were made, the resources that were embezzled. What do we do now to make sure that, we don't get, we minimize or at least contain whatever damage that we may still be confronted with?
Now, what is left now, Vuyo, is for the individual to say, this is a decision that I am taking for myself, for my loved ones, for my family, for the society at large. You need to wash your hands regularly with soap and water, use hand sanitizer, wear your mask, keep a safe 2-meter distance, do not socialize, do not attend social gatherings, do not go anywhere where you do not need to be. Now, there has been lockdown since yesterday, so ideally I would be saying go to work, come back. If your category of employment allows you to do that, go to work, come back, go buy your groceries, go back home. Do not socialize. Do not attend illegal parties. Do not go to nightclubs when they are not permitted. Do not travel into Gauteng except for business. If it's leisure, do not do it. Do what is supposed to be done in terms of the non-pharmacological, because unfortunately at the moment, that is the bulk of what you can do. And there was a report, I think it was in the City Press yesterday, where you had about three doctors painting the picture very glaring. Do not get sick because you will not get a bed. If you are this age and you need a ventilator, you're not going to get it. That is the reality of the situation. And there have been doctors there who have been saying this for the last 2 weeks. We are treating patients in ambulance bays, in ED. We do not have beds. So you do not want to get sick. So protect yourself. One of the briefings that the president gave a while back was, it's in your hands. It's never been truer today. It is in your hands.
Dr. Khumbudzo, thanks very much for your time this evening.
Thank you very much.
Sangwa Khumbudzo, of course, based in the United Kingdom. Well, as in case you thought that, there's no way around this, well, it goes back to the basics. Wash your hands. Do the right thing. Yes, we can complain about what's going to happen next and how inconvenient this whole thing is. And of course, the hemorrhaging of jobs that is coming with this pandemic, no doubt. But as things stand, and with what the minister speaking for cabinet said today, apartheid, vaccination, so it doesn't look like we're going to see a way out anytime soon. And the best we can do, as Dr. Khumbudzo was saying, is to go back to the basics. Time now for a quick ad break. The Watchdog returns in a moment. Welcome back. This is the Watchdog. Now, a number of organizations have come together to begin to document what they call systemic failures within the system that are outside of the COVID-19 pandemic. And the trend that they are beginning to see is quite troubling. Now, one of the organizations that have been involved in this, together with others like Positive Action Campaign, Positive Women's Network, the South African Network of Religious Leaders, NAPWA, National Association of People Living with HIV, as well as the Treatment Action Campaign, have come together to do this task, to also sensitize those who are in power about some of the failures that they are beginning to see in the system, while while we are still busy with the COVID-19 pandemic. Anele Yawa is the General Secretary of the TAC, and he joins us now to talk us through some of the things that they are beginning to see. Mr. Yawa, good evening. Thank you very much for your time. So you have started this, what you call community-led monitoring system, and you've begun in the Northwest. Take us through why you started with this initiative in the first instance.
Greetings to you, Vuyo, and the viewers at home. So this community-led monitoring is called Richize. As you have alluded, is made up of 5 organizations, which we have mentioned, and it started working in 2019. This initiative of Richize, you will remember that in South Africa, we've got PEPFAR, which is Presidential Emergency Plan for AIDS Relief, that is working in 27 districts of South Africa, and they have invested a lot of money for HIV and TB response. So our duty now through the Richize project is to monitor services that are meant for people living with HIV, people living with tuberculosis, the key populations, and other public healthcare users in general. So that's what we are doing. Richize is working in more than 400 clinics in 8 provinces of South Africa. So through the Richize project, we have been doing the community-led monitoring, where we go to specific clinics that are adopted by PEPFAR. Reason being that in these clinics, there are a lot of resources that have been put to improve the quality of services. So these are the clinics that we are monitoring. In December last year, we produced the first report of Gauteng, and last month we produced another report of Mpumalanga. So Northwest Province is a 3rd report that we have produced so far.
And take us through some of the key findings.
So some of the key findings. So you will remember, Vuyo, and the viewers at home, that in South Africa, we have an estimated number of about 8 million people living with HIV. And out of that 8 million, there is an estimated number of about 5 million people who are on antiretroviral treatment, and another estimated number of 3 million not yet initiated. But the problem we are experiencing as the country is that there are a lot of people who have been tested, and a lot of people are lost on follow-ups or have defaulted. And one of the questions that we are trying to find out is to say, what makes so many people to be lost on follow-ups? One of those issues that came out clear is around issues of staff attitude that leads to stigma and discrimination of people living with HIV, TB, and other illnesses. And the other issue is the non-availability of medicine and medical supplies. And the other issue is around long waiting hours when people go to clinics, and also issues around infrastructure. And also the other thing is around services that are meant for key populations. And also the other issue that we picked up are healthcare services meant for migrants, both documented and undocumented. And the other issue that we are picking up through this report is the issue of people missing appointments in clinics when they are shouted at and where they are made to stand right at the back of the queue. But also on the report, we are picking up issues around TB infection control and issues around TB services. So these, in the main, are issues that are coming up out of this report, where we are bringing evidence as to say, in this clinic and in this clinic, this number of people that we have interviewed, this was the response. And then in this clinic, this is the number of people that we have interviewed on this question, this is the response. But the good thing about this report is not only about something that is written down. After we are done, with the data that we're collecting, we're able to analyze, produce a report. Within that report, there are possible suggestions or recommendations that we are presenting to each provincial department of health, as to say, as the mouthpiece of the public healthcare users. You will remember, Vui, that in South Africa, healthcare workers have unions, but patients do not have unions. Healthcare workers, when their rights are infringed, they know that they will run to their unions. But when patients' rights are violated, patients and the public healthcare users have nowhere to run. So we are coming in now as these organizations to say we are public healthcare users, and we represent the majority of the public healthcare users, the majority of people living with HIV and TB. Let's sit around the table with government officials and identify these problems, and so that we can work together in coming up with possible and workable solutions that will ensure that we improve the quality of services in our clinics, so that people, they don't end up deciding not to go to clinics because of the attitude of the nurses, because of long waiting hours and all whatever.
Now, these attitudes, hours, and everything, I mean, you have been saying this for a very long time. And I'm not, dissing your report. I'm just saying, it sounds to me like it's the problems we've been having since. In other words, these are not problems that started with the advent of the coronavirus pandemic. These are problems that have been there for the longest time. Would you agree?
Yes, I will agree with you 100%. You will remember, Vuyo, that in South Africa, we've got, firstly, before the advent of COVID-19, we have been having a lot of posts within the health department which are frozen. Our healthcare workers are overburdened, are overworked, and they are human beings. At times, they will make these mistakes. And we strongly believe that if the Department of Health can make sure that we hire more nurses, not on contract basis, on permanent basis, then that will lessen the burden of work many healthcare workers are faced with in our clinics. And two, it is important that on continuous basis, the Department of Health has a program that is going to refresh the healthcare workers about their mandate, to say, we as the public healthcare users, we are clients of the Department of Health. Therefore, if we've got particular principles and all these policies, we expect that as patients and public healthcare users, when we go to clinic, if the clinic opens at 8 o'clock, we expect that people to be served at 8 o'clock. Not a situation where you find out that a clinic opens at 8 o'clock and then from 8 to 9 o'clock, nurses go to the room, update their Facebook status and WhatsApp, and 9:30 they go back and collect the files and serve the people, and from 9:30 to 10 o'clock, all of them, they go to tea. And then, and also in some facilities, you find out that when people go after 12, they are told that they must come tomorrow because they are done with the registration. Some facilities, they don't serve people after 2 o'clock, yet these healthcare workers are paid for 8 hours. So people are made to not to access healthcare services, not because of all the times, because of the failures of the system, but also it has something to do with the attitude of those who are working within our facilities. Lastly, so in these clinics, or in these 27 districts, in 2019, when Minister Aaron Motsoaledi was still the Minister of Health of South Africa, they promised the PEPFAR that as part of a turnaround plan, they will come up with a 10-point plan. One of the things the Department of Health of South Africa promised to PEPFAR with regards to these clinics was to say some of these clinics will open extra hours. Instead of closing by 5 o'clock, they will close 8 o'clock. Some of these clinics will open on weekends. And when we went down on these clinics, we found out that the promise that was made by the South African government with regards to these clinics has not been fulfilled, because some of these clinics, are closed by 5 o'clock. Some of these clinics are not opened on Saturday. So these are some of the issues that we feel that they need to be addressed, because when you engage at the facility directly to say, according to the circular, you are supposed to close at 8 o'clock and you are supposed to open on Saturdays. They will tell you that that was the national arrangement. At local, we don't have an arrangement like this because it must cover issues of overtime allowance, issues of extra staff. So in some areas, the national department takes decisions and those decisions are not communicated at the provincial level in order for them to be implemented to ensure that the quality of services for health is improved for all in South Africa.
What has been the response of the 3 provinces that you've engaged with on the back of the reports that you have compiled in Mpumalanga, the Northwest and Gauteng?
To be honest with you, Vuyo, the response of the provinces is lukewarm, because what we expect is that we produce these reports, we hold public hearings where we bring together the duty bearers and the public healthcare users, and these reports are written. And all what we get from the Department of Health when we present this report is a note. And our expectation is for them to call us into a meeting, to sit around the table so that we can identify all the issues and all the possible recommendations or possible solutions and engage with them as to say, how are they going to be implemented? What will be the time frame? Since from December last year until now, Gauteng has not came back to us to sit around the table. Mpumalanga has not came back to us. The west part of it, Northwest, was there, and we expected them to say something. The official of Northwest who was deployed to speak there, maybe she spoke only 3 seconds. We never got a commitment. But also we are saying, we will reach out to the MEC of Health. We will reach out to the HOT. In March this year, we presented a report to the South African National AIDS Council plenary meeting, which is led by the Deputy President of the country, Didi Mabuza. And the Deputy President promised that based on the report of Northwest shortage of medicines we presented to plenary, he is going to visit Northwest. We are told that either today and tomorrow, or tomorrow and a day after tomorrow, they will be in Northwest attending those issues. All what we are calling for, Vuyo. We cannot have premiers who are supposed to lead provincial AIDS councils in their provinces, yet they are not doing that. We are calling on Premier Job Mokgoro to pull up his socks and come to the party, because people in his province are dying. And also we are going to sit around the table with the MEC of Health, with the HOD. You will remember, Vuyo, that Northwest is still under administration, and we will sit down with the national administrator and identify and sit down and present to them some of the issues that we have identified. In Northwest, in the provincial depot, there are senior officials who were suspended 2 years back, and those senior officials are suspended with pay. What we want to know, what is it that is delaying its disciplinary processes for these officials in order for them, either they are dismissed or they are returned back to work, because we strongly believe that their suspension has a contribution to what is happening in the depot that leads to shortage of medicines in some instances.
Now, clearly, and by our own admission, these problems have been there for a very long time. Promises were made to address them, but as you have just said, those promises have not been fulfilled. Now, you're an organization that has a very rich history of forcing change. You developed a brand of activism, that enabled us as a nation to move forward on issues where the state was actually digging in its heels. Any thoughts about how, to mobilize broader South Africa around these issues? Yes, we may be caught up in this whole COVID pandemic as things stand, but hopefully sooner rather than later, that too will, come to an end. And these problems will, in all likelihood, continue. What should we do as South Africans to really, put our efforts behind your efforts and behind your campaigns?
Responding to your question, Vuyo, I will respond as the General Secretary of TAC now, and not as Richards. One, for a long time, TAC was accused of being a movement that is anti-state, a movement that we are turncoats. We tried as TAC to prove the world wrong, where we said from the streets to the boardrooms, let's identify the problem, let's sit around the table in order for us to resolve the problem. The reason we have since decided that is because we are bringing now an evidence-based advocacy. But also, I am calling on behalf of TAC, we are calling upon our government and government officials not to take us cheap. We are not cheap. We are citizens of this country. There will be a stage, Vuyo, where we will be fed up with all these arrangements and working relations we have with government. If these working relations that we have with government do not work to improve the conditions on the ground, there is no need for us to continue with relations that do not serve the interests of the people. At some point, Vuyo, and the people of South Africa, as TAC, we will reach a point now where we say, let us stop now. Let us speak the language our government and officials understand better in order for them to be able to respond to the needs of the people on the ground, to the needs of the majority of the public healthcare users. But now, we are trying by all means to be civil. But at times, there are those officials within the government who are pushing us to that corner where we will decide to take it to the streets. We don't want to take it to the streets now. We want to engage because we have been accused as TAC to say we like to use the media while you don't engage with us. And now we are engaging, but we don't get a commitment. To have a meeting, Vuyo, with government officials and not have commitments and not have timeframes on how those problems are going to be resolved is just like not having a meeting. We need to be taken serious. And the only way to be taken serious is only when the officials of government comes and sit down with us. We identify the problems, we present to them, we agree how are they going to be resolved, when. And when that is not happening, they must know that we are the citizens of this country. We are products of the liberation struggle of South Africa. We are the voters of this country. And if the situation pushes us to go back to civil disobedience, the officials of government and government must know that it is not of our own making, but it is because of what they do and how they treat the public healthcare users and how they attend to issues that we are presenting to them. If they want us to take them serious, they must take us serious, or else we will at some point lose it and take it to the streets again.
That's where we're going to leave it for this evening. Thank you very much for talking to us this evening, Anna Leao, who is, of course, the General Secretary of the Treatment Action Campaign. This conversation on the back of a third report, as you have heard him there, that they have produced over the past year, documenting problems that within the health system, but in particular affecting people living with HIV and tuberculosis. Well, tell us what you think of this conversation and what needs to be done. Now, we've come to the end almost of tonight's program, but do watch us again tomorrow. One of the key issues South Africans are talking about right now around the South African Health Products Regulatory Authority, and that's the body that looks at vaccines, approves them, looks at what works and what doesn't, the dangers that each may pose, and how we may be able to overcome those. So that conversation, I hope, will take place, which will have taken place today. Tomorrow, tomorrow evening, same time. It's a very important organization about which we know very little. You'll recall last week, one of the major political parties, the Economic Freedom Fighters, marched on that organization. We'll have them explaining the work that they do, why it is important, and why they've been doing things the way they have been doing them. So, till we meet again tomorrow evening, have a good night.